Hello everyone. Today we're going to be talking about behavior therapy. And first I'm just going to give you a little bit about the history and where it came from, how it came to where it is today, and some significant figures that contributed to this therapy along the way. Well, first, behavior therapy first appeared as a systematic approach in counseling and psychotherapy in the treatment of psychological disorders in around the 1950s, 1960s. It was initially defined as the application of modern learning theory to the treatment of clinical problems, with an emphasis on classical and operant conditioning. However, it has developed even more so over the years since then. Contemporary behavior therapy applies not only principles of learning but also experimental ways of learning. It implies also experimental findings from scientific psychology. The two are very close related, also to the treatment of specific behavioral disorders. It's an empirically based approach to therapy that is broadly combined and centered around social learning-oriented therapy. By the 1970s, it had become a major approach to counseling and therapy. Also, there are three main areas that we will look more into later on of behavior therapy and some more others attached along with it. Three major thrusts that are considered in this therapy are counter conditioning, contingent management, and cognitive behavior modification. But first, let's go over some of the significant figures that help prolong and develop these three core areas of behavior therapy. Behavior therapy actually does not have a founder, but it does incorporate several key figures, which include Joseph Walp, which we have right up here. B.F. Skinner is another. Also Donald Meckenbaum. These three figures here are core figures in those three categories, such as Walp was developer of counter conditioning, Skinner contingent management, and Meckenbaum cognitive behavior modification. But there's some other figures as well that we do want to recognize, such as Hans Heisnick, Fishman and Franks, Glass and Arnkoff, Parrett, Prostata and Norcross, Scharf and Wilson, and there's many more figures that help develop this theory along the way. Behavior therapists view human beings as products of their human environment and unique learning histories, so human nature is not necessarily positive or negative. The three figures I want to focus on and give a little background on are these three listed right up here. Wolpe gravitated to the conditioning theories of Ivan Pavlov. I'm sure some of y'all have already heard of him before, and his work on classical conditioning, which is where he further formed his counter-conditioning theory. He also gravitated toward the theoretical work of Clark Hull in his conditioning. He began to use a deep relaxation to counter-condition anxiety and also hence developed systematic desensitization as a unique behavioral therapy or intervention for treating phobias and anxiety problems in patients. He also used an assertive response to exhibit social anxiety, leading to the development of assertiveness training. Next, Skinner, which his full name was actually Burgess Frederick Skinner, has been listed as one of the most influential psychologists of the 20th century. He pursued to be a writer, but when that did not work out, he actually started along to some inventions which led him down the psychological path of pursuing psychology. He started creating significant inventions of experimental psychology and helped researchers to monitor recorded behaviors in an unobtrusive way. He did not believe in human free will. He is often viewed as the father of behavioral psychology. He believed that behavior is determined by environmental events and that behavior is governed by its consequences. And lastly, we have Donald McConnenbaum, who has also helped further along the development of behavior therapy into a broader spectrum, where he bases it on a cognitive behavioral approach by emphasizing the crucial role of self-instruction or self-talk in the regulation of one's emotions and behaviors. He conducted important research of self-instructional training as a cognitive behavioral intervention to help people instruct themselves to cope better with different types of problems such as impulsive behaviors in children or other examples such as schizophrenic patients.